So if we sort of dig a little bit deeper into the types of exercise we might use in this population, if we look at the evidence, hip exercises, so we want to combine hip and knee exercises, and that's preferable to using knee exercises alone. And the hip exercises that we would tend to use would target the hip extensors, hip external rotators and abductors, and we can do this in a lot of different ways. Okay. In terms of the types of exercises we could do around the hip, we've got, in a gym setting, we could use cable machines to work on hip abduction or adduction. We could use a bar with weight on it to work on hip extension or hip thrust. We could also look at kettlebell swings, so you're getting a little bit more of a closed chain whole body hip extension type movement. And then we can adapt these to a home environment as well. So we can swap the cable for a TheraBand. We can give our patients a kettlebell to take home to do that. And they could also put a small weight on their hip to do the more hip extension based activities. So around the knee, remember that this is part of that bigger program. So really what we're trying to do here is target the quadriceps mainly. We know that quadriceps weakness is a risk factor for developing patellofemoral pain, and we know that the majority of people with patellofemoral pain do have deficits in their hip, in their quadriceps strength. Why it's important to target the quads is that we know that quads weakness is also a risk factor for knee OA. And so if we're thinking about protecting the longer term health of the knee, the quads are absolutely fundamental to include in our program. So in a gym-based program, this could involve an open chain leg extension exercise, so on a leg extension machine. You could take someone through more of a closed chain exercise, so a squat or a leg press. And then again, these translate into a home program. So you could use TheraBand to do extensions. And what a really important point to note here is you can get TheraBand now that is really hard. So going up to that sort of silver and gold level where you get really hard resistance in that band. So it's not like we're giving someone an underloaded exercise anymore with TheraBand. They could also perform at home some squats with load. So they could do that with, again, holding the kettlebell or holding a weighted vest or a backpack even worn on their front, or even something really simple like we spoke about before, just getting out of a chair on one leg a number of times. That in itself can be quite challenging as a starting point for someone. What I think it's important to be aware of is the load that goes through the patellofemoral joint when you're doing an open and a closed kinetic chain exercise, particularly if your runner has a pain flare. So we know from the work of Chris Powers that patellofemoral joint stress is lowest for leg extension, so an open chain exercise from 90 to 45 degrees of knee flexion. And for a squat or a leg press or closed chained exercise, we know that PFJ stress is lowest from 0 to 45 degrees knee flexion. And so that combined with potentially when people are experiencing pain during those particular exercises can give you a bit of an indicator as to what range to take someone through, particularly when they're first starting out on these exercises.
That was a great range of exercises there, Nat, and yeah, there's obviously a lot of different options out there, but I like your message of keeping it simple for the patient, and then if they need variety from there and you want to change it up and give them something different, then you can go from there. In terms of the range, I guess that you kind of answered my question, but would you start them off in a pain-free range, or are you okay with a 1 or 2 out of 10 and then you progress the depth or the range from there?
Yeah, I think it really depends on the person. We tend to work with a pain severity of anywhere between 0 and 2 out of 10 as being acceptable during exercise. If it's starting to creep, 3, 4 higher, then we absolutely need to modify that exercise. And I think particularly if you've got someone who is starting to show those signs of kinesiophobia or pain catastrophization, if they're anxious about pain and the damage that they're causing potentially to their knee, you might actually want to start them with an exercise that doesn't cause them any pain. And that could be as simple as a wall sit, where they're just getting a really nice isometric contraction of their quads without, and you can pick the point in range that isn't painful for them.
Yeah, no, that's a really good point, to get their trust, and then you can start to push them a little bit from there.
Yeah.
Yeah.
There's lots of things you can do to manage pain during exercise. So we can modify the exercise, we can try taping, I've also found in some people actually giving them a particular exercise to start with in their program. So whether it's an isometric quads exercise like a wall sit, or I had one patient who always did their open chain leg extension exercise first, because that really helped with their pain when they went on to the closed chain stuff. You can also consider things like blood flow restriction training. I've certainly used that for some people who have really struggled to just get any movement with minimal pain. So there's certainly tips there that you can, for the people who are tricky to find an exercise that is either low pain or no pain. There's some tips there that you can use.
Yeah, I totally agree with that open chain. I've got a bit of PF, and yeah, I do like a few not through my full range, and it just almost gets the quads going, and then I can actually like get through more range as the sets go on. So yeah, I totally agree with that point.